If you have bipolar disorder and you'd like to know what's actually going on inside the bipolar brain, and are there any effective self-help treatments we can use to try to improve the condition, then this is the right video for you. There are 13 scientifically known issues that cause bipolar disorder, and by the end of this video you'll have an understanding not just of what they are, but also how we can use this knowledge to develop self-help treatment approaches to combat these root causes and hopefully stabilize the condition. My name is Peter Smith. I have bipolar disorder myself, and I've been practicing nutritional functional medicine since 1988. I specialize exclusively in the treatment of mental health conditions, especially bipolar disorder. In this video I want to present a revolutionary new understanding about what really causes bipolar disorder that enables us to construct effective self-help treatment strategies to combat the condition. So let's get into the details of the 13 causes of bipolar disorder and the 2 consequences. Number 1, let's start with looking at neurotransmitters in bipolar disorder. If you intend to try and use natural self-help therapies to keep the neurotransmitters in your bipolar brain in balance, you're going to need to be able to recognize which of your neurotransmitters has gone out of balance in the first place. And then the second thing you need to know is which combination of supplements and other treatments you can use to bring it back into balance. You might think the best way to do the first part is to have your neurotransmitter levels tested, laboratory tested. But unfortunately, neurotransmitter tests just don't work. They just don't actually tell us what's going on with the neurotransmitters inside the synapses. I'm sorry to tell you that, but they just don't work. Don't waste your money. It would take up too much time here to explain why that is. So actually, I've just decided I need to make a separate video so I can critically explain why neurotransmitter tests are a total waste of money. Now, even if neurotransmitter tests could tell us if the neurotransmitters in our synapses are too high or too low, which they don't, neurotransmitters are only one piece of the jigsaw puzzle. For example, as we'll see in a minute, another imbalance in the bipolar brain is in second messenger signaling systems. Even if neurotransmitter levels were within the normal range, a person could still have too much manic signaling firing in their brain because of excessive second messenger signaling. The whole purpose of this video is to explain that there are many other causes of bipolar disorder. You see, today, thinking that bipolar disorder and other mental health conditions are just chemical imbalances in the neurotransmitters is so 2000s. It's like a quarter of a century out of date. Now, please don't misunderstand me. I'm not saying that neurotransmitters are not still really important. And keeping them in balance is a great way to gain some control over bipolar disorder. When I finally embraced that I had bipolar disorder, the first thing I turned to as a treatment strategy was to start taking control of my neurotransmitters. I learned how to lower glutamate, how to increase or decrease dopamine levels, how to correct serotonin metabolism, and GABA. And although it was a great start, my condition was still incredibly unstable. You see, I have the rapid cycling feature, so 6 times a year, hypomania would attempt to hijack my brain, and I would have to nip it in the bud by lowering dopamine and glutamate. Sometimes I would overdo it and flatten myself. But if I didn't nip it in the bud really quickly, I would then suffer from weeks of depression. So it wasn't a complete solution, but it was still way better than how I used to be, with absolutely nothing in place to control the hypomanias, resulting in horrible long suicidal depressions. The more I learnt about and started to target all of the other things involved in bipolar disorder, the more stable my condition became. And today, I'm in my 15th year of keeping my rapid cycling bipolar type 2 in remission, full remission. Sometimes people have a dominant polarity, and my dominant polarity is depression. So from my teens through to my 50s, that's 4 decades of my life, I lived with depression and suicidal ideation over 60% of the time. Today I haven't had a single day, not even a single hour of depression in the last 15 years. So if having your neurotransmitter levels laboratory tested is not the way to go, how can we work out when one of our or more of our neurotransmitters has gone out of balance and we need to make a correction? The technique I've developed in my practice is to learn to read the science, the psychology and behavior that indicate imbalanced activity in a neurotransmitter. I know that might not sound very accurate, but it actually works really well. And another thing is it's immediate and up to date. If I observe myself demonstrating risk-taking behaviors in the pursuit of hedonistic pleasures, if I'm overspending, there's addictive behaviors, or even just thinking about addictive things, hypersexuality, excessive energy and drive to pursue rewards, especially pleasurable, exciting rewards. I don't need a lab urine test to tell me that the dopamine circuits in my brain have become hyperactive. I can just read the signs. And also, in that situation, I need to make an immediate intervention. I'm already in a manic or hypomanic state. I don't have the luxury of time to wait for 10 days or a couple of weeks for the lab to send the test results back to me. And each of the neurotransmitters has different telltale signs. So for example, glutamate just speeds the brain up. It's just pure speed, energy, an inability to sleep. Norepinephrine or norepinephrine, depending on how you pronounce it in your country, diminishes our perception of risk. So we engage in risk-taking activities. Imbalances in serotonin and GABA also give off very characteristic signals. Now, it does take some self-awareness and a little bit of training, but I believe we can learn to read the signs as accurately as meteorologists, weathermen in old speak, can read all the atmospheric signs and can reliably predict when there's a storm heading in your direction. For sure, there's variability and nuance in how these things manifest in different people and the different lives that people lead. And initially or in the past, you may not have recognized these states because they feel totally normal to you. Something that I see all the time in my practice is once people have made a connection between a particular feeling state or behavior and a neurotransmitter, they start to become much better at recognizing when that neurotransmitter is going out of balance. I mean, they notice subtle changes and start to discover other telltale signs that help them to understand the fluctuations and variability of their neurotransmitters in their bipolar brain, and then how to make a correction. If you'd like to get my professional help in learning how to recognize these signs, I do one-to-one consultations online. One of the things we would do is look historically back at how the bipolar disorder has manifested in your life, or is currently manifesting, and look at those behaviors through the lens or lenses of neurotransmitter imbalances. And then what happens after that moving forward is as you start making adjustments and seeing how the adjustments, let's say you made an adjustment to bring down dopamine, you would see how that changed how you thought, behaved and felt. Through this process, we can become quite aware, intuitively aware of our neurotransmitter balances, way better than any urine test can tell you. In bipolar disorder specifically, we need to be able to recognize when glutamate has gone too high, when dopamine and norepinephrine have either gone too high or too low, and when and if serotonin and GABA are also involved. The neurotransmitter glutamate is a really central player in bipolar disorder. Excessive glutamate speeds the brain up into a manic state. Excessive glutamate is also really toxic and damaging to the brain. So to live a long and mentally healthy life with bipolar disorder, every day we need to prevent glutamate from going too high. There are several supplements I take myself and use in my practice to combat elevated glutamate, including lithium orotate, glycine, sarcosine, zinc and low-dose NAC. I might make a separate video about each of the neurotransmitters involved in bipolar disorder, so there would be a video just on glutamate. Depending when you're watching this, that might be available. Now, dopamine and norepinephrine or norepinephrine, they hijack our behaviors, making us hyper-motivated, focused, driven, pursuing pleasurable rewards and risk-taking. They drive addictive behaviors. And both dopamine and glutamate are involved in paranoia, which can often be a feature of bipolar disorder. I myself lived with paranoia from the age of about 10 or 11 through to my mid-50s. It was actually the last thing I ever got under control, and I did so by targeting the NMDA receptors in my brain. No longer living with paranoia is such a relief. I'm not going to mention or give any lists of dopamine boosting supplements. You're free to look it up for yourself online, but I don't recommend it. If you have bipolar disorder, do not take any dopamine boosting supplements until you've gotten a firm guardrail established against mania, even if it means temporarily continuing to live with depression. Supplements I take myself and prescribe to keep dopamine in check include lithium orotate, bacopa, white mulberry leaf, and if ever these measures were not sufficient, I could add much stronger anti-dopamine supplements including BCAAs and boosting acetylcholine. Additional strategies to counteract elevated dopamine and norepinephrine during mania are lowering glutamate and increasing GABA to raise the threshold required for dopamine synapses to fire. And another strategy is to inhibit second messenger signaling, which we'll be taking a look at in a minute. Now, with regard to serotonin, before you even think about taking supplements to boost serotonin, you need to eliminate chronic inflammation from your brain, because chronic inflammation is what drives serotonin metabolism out of balance in the first place. Inflammation in the bipolar brain is coming up next. And finally, GABA. This is the brain's primary inhibitory neurotransmitter. It puts the brakes on the brain. Because of the way GABA is distributed throughout the brain, when it becomes deficient, the primary telltale sign is the quality of anxiety. A very simple, very healthy, and quite surprisingly effective way of optimizing GABA levels is to just regularly, every day without fail, consume several cups of green tea. Green tea contains some brain-friendly polyphenols called catechins. It also contains something called L-theanine. You can also buy L-theanine as a supplement if you don't want the green tea. Theanine boosts GABA, but not in a way that is tranquilizing. Theanine also helps to make us mentally sharp. If you don't like the taste of green tea, it's probably because you don't know how to make it. You don't pour boiling water on green tea. Look it up. Now, when you know how to recognize the early warning signs that one or more of your neurotransmitters has gone out of balance, it then empowers you to make interventions with an appropriate combination of supplements and other treatment techniques. Of course, I need to quickly say something here. There are no guarantees of any medical treatment working. I'm not encouraging you to discontinue taking any medication you need to keep you safe. In fact, I'm saying the opposite. Don't stop taking any medicine that you need to keep you safe. This is just a mental health educational video, and you should consult with a qualified practitioner before adding or removing anything in your prescription. But having said that, realistically, there are a lot of natural self-help therapies that you can do safely as an adjunctive therapy to any pharmaceutical prescriptions you're on. For example, you can improve your diet, you can improve your gut health, you can recalibrate your sensitivity to stress responses, eliminate unnecessary sources of inflammation in your body and brain, and do several other things. Okay, now let's move on from neurotransmitters to neuroinflammation, or inflammation in the brain. I'm sure many of you have heard by now that we now know there is increased levels of inflammation in the brains of people with bipolar disorder and other mental health conditions. A simplistic way to think about it is inflammation is a driving force that activates the condition and reactivates the condition. It disrupts neurotransmitters. Inflammation drives up excess glutamate, dysregulates dopamine and serotonin. With regard to serotonin, I would say you cannot fix serotonin metabolism until you get rid of chronic inflammation in the brain. Inflammation disrupts neuroplasticity, it kills neurons, and can prune away synaptic connections faster than your neuroplasticity can grow them back again. This results in depression. Today we need to move on from thinking about depression as just low levels of neurotransmitters inside the actual synapses, but rather it's a lack of actual synapses because chronic inflammation has been pruning away the synaptic connections faster than you can replace them. Another unfortunate thing inflammation does is it accelerates the rate of brain death and brain shrinkage. This contributes to a loss of mental function and accelerated brain aging. I'll discuss this later and what we can do to prevent it. To me, it looks like we people with the big mental health problems, that's bipolar, schizophrenia, OCD and depression, appear to have brains that are more easily attacked and disrupted by external sources of inflammation like infections and external stress. Not only that, but it looks like we have inherently hyperactive immune systems, or immune systems that don't switch off very well. And the result of this is we overproduce inflammatory chemical messengers called cytokines. Today, cytokines are a major focus in psychiatric medical research. When the immune system is provoked, whether it be from an infection, toxins, or psychological stress, it discharges cytokines that distribute inflammatory signals throughout the body and into the brain. And then the cytokines can change brain function. This understanding has been a complete revolution over the last 15 years in the understanding of psychiatric medicine. We used to believe that mental illness definitely started in the brain and ended in the brain. It was all in the brain. We're now understanding that what could trigger what's going on in the brain could be an inflammatory situation going on in another part of the body. It also explains the physiology, or biology if you want, of why does external psychological stress, what's the biological mechanism whereby external psychological stress can trigger physiological changes in the brain resulting in mental illness. This new understanding is still in its infancy and we've got a lot more to learn. But it's already really cool. Understanding that inflammation is a driving force in mental illness opens up revolutionary new treatment strategies. Put it like this: if you want to live well with bipolar disorder and other mental illness, including depression, schizophrenia, OCD, focus your treatment strategy on eliminating every source of inflammation that you possibly can, from psychological stress to internal chronic infections, a lack of sleep, a lack of exercise, a poor diet, etc., etc. There are also anti-inflammatory supplements to bolster the effect. And at the same time as you're reducing inflammation, you want to be boosting neuroplasticity, because these two things sort of oppose each other in a way. For me personally, when I adopted eliminating inflammation as a central strategy to treat my bipolar disorder, it put my rapid cycling bipolar disorder into remission and has held it there for 15 years. And you can use reducing inflammation as an adjunctive therapy alongside your pharmaceutical treatments and hopefully achieve a better outcome. And today we know a lot of things that we can do to reduce inflammation, from the foods we eat, the foods we don't eat, even the timing of when we eat, recalibrating our stress responses, developing a healthy gut microbiome, getting enough sleep, exercise, supplements, eliminating infections. It's a big list. There's a lot we can do. I'll be making a whole separate video just on inflammation. To make a start on combating inflammation in the brain, the first thing to do is to track down and eliminate sources of inflammation. If you're carrying something significant like Lyme disease, you need to work with a Lyme disease specialist to get rid of that. If you've got food sensitivities and allergies, they need to be cleaned up. If you have a leaky gut, that needs to be fixed. Pretty much everybody could benefit by recalibrating their stress responses. I'll say more about that later. Make sure you're not sedentary, getting enough exercise, getting enough sleep. These are all fundamental and foundational things, cutting off the source of the inflammation. Then on top of that, you could stack some anti-inflammatory supplements. Top of the list in equal first place would be EPA. That's a component of fish oil, so you want a high EPA omega-3 oil. Curcumin, lithium orotate, and I also use some selective anti-inflammatories like skullcap is anti-inflammatory and boosts neuroplasticity, but with a particular affinity towards the dopaminergic systems in the brain. Or I might want to use gastrodia to target more the GABA systems in the brain. But there's another really powerful treatment to reduce inflammation in the brain. You see, the cytokines activate the brain's immune system cells called microglial cells. They start discharging too much glutamate and they remain active really pretty much indefinitely once they've been activated. What we want to do is to kill off the activated microglial cells, cycle them out and have them replaced with dormant ones. And hands down the best way to do that is intermittent fasting. So I've got a special technique. 1 day a week, you eat only 2/3 of your calorie needs and you take some extra supplements that boost what are called autophagy enzymes. The autophagy enzyme systems become activated when we're fasting and they sort of gobble up old mitochondria, activated microglial cells. They sort of clean the body up. If you'd like to receive instructions, just like a PDF document on how to do that fasting technique, what supplements to take, stick around to the end of the video and I'll tell you how you can get that. Okay, number 3, moving beyond neurotransmitters and inflammation, let me introduce you to something you probably haven't heard of before. There's a protein called GSK3. Everybody has it, but in the brains of people with bipolar disorder and depression, we have too much of it. And lowering GSK3 should be one of our main therapeutic targets. The major pharmaceuticals used for bipolar disorder, lithium carbonate, sodium valproate, work at least in part because they lower GSK3 levels. It's a little difficult to explain what GSK3 does because it does so many different things. It's a significant player in regulating our inflammatory responses. It disturbs neurotransmitters. It's involved in neuroplasticity. High GSK3 inhibits the brain's ability to repair and regenerate itself. Animal studies have shown high GSK3 shortens lifespan, and lowering GSK3 extends it. GSK3 is also involved in regulating our sleep cycles, which is something that often goes out in bipolar disorder. Beside the low-dose lithium orotate that I use, it took me years to find additional supplements that have GSK3 lowering effects. There's the polyphenols luteolin and quercetin. Quercetin has to be taken at very high doses though to lower GSK3. But the most powerful one, second maybe to lithium orotate, and when you put the two together you can get a really good effect, is a herb called andrographis. Personally, I only need a really small dose of andrographis. If I take too much, I just immediately get an emotional flattening, which is, of course, a response I would want if I was going into mania. I would take a couple of flat days to end the mania so I didn't go on and get a depression. It may be too early to say for sure, but it's beginning to look like controlling GSK3 may be a very central and powerful strategy for managing bipolar disorder. Right, moving on to another thing that may be new for many of you. It's called the second messenger signaling system, and it's really important in a bipolar brain. Think of neurotransmitters as the first messengers. They send a signal between the nerve cells across the synapse. But once the signal has arrived on the receiving neuron, it's relayed along the inside of the nerve cell with what are called second messengers. And in bipolar brains, these second messengers become excessive. We see here a classic diagram of a synapse. This nerve cell is sending a signal to this nerve cell. It produces neurotransmitters, stores them in vesicles, releases them into the synaptic space. They travel across and attach to receptor sites on the surface of the receiving neuron. The neurotransmitters don't pass into the receiving cell, they just sit on the surface. I'd sort of push a button if you want, or trigger a response inside the receiving neuron, and this response is the second messenger signaling. Now in a bipolar brain, we produce excessive second messenger signals. We've got too many of these proteins called GS, which stands for stimulating, compared to GI, so we don't have the right balance of stimulation versus inhibition. We make too much of some of the downstream proteins, and when this system goes out of balance, as it does in a bipolar brain, it can produce really large and also quite long-lasting firing of the neurons, producing the kind of overexcited, over-energetic hyperactivity within the brain that we see in mania. So far, no drug has been specifically developed to treat second messenger or inhibit them, but lithium carbonate and sodium valproate used in psychiatric medicine, actually part of the way that they work is because they inhibit second messengers. Interestingly, there's a drug which is called tamoxifen. It's an estrogen blocker. It's known to inhibit second messengers and have anti-manic effects. The second messenger inhibiting treatments I use in my practice, the supplements are lithium orotate, skullcap, luteolin, quercetin, quite high dose. Curcumin, indirectly, it inhibits the calcium release that's part of second messengers. Resveratrol, omega-3 oil, just ignore that question mark. And another really important thing to reduce one of the second messenger pathways is stress reduction. And that brings us nicely on to the next section, number 5, which is stress and the HPA axis. A consistent finding in brain scans is that in the bipolar brain we produce exaggerated and above average stress responses. This results in chronic overproduction of the stress hormone cortisol and is one of the significant things that drives up inflammation in the brain. It's really important to understand this and do something about it. If you have bipolar disorder, it means that in your brain and my brain we have this dysregulated stress response constantly or chronically triggering the immune system and inflammation system and putting a destabilizing pressure on our brain. The pathway in the body that sends signals from the brain down to the adrenal glands to make the stress hormone cortisol is called the HPA axis. Dysregulation in the HPA axis and stress hormones also drives down neuroplasticity, which is the brain's ability to repair and protect itself. It directly imbalances the neurotransmitters glutamate, driving it up, serotonin and dopamine. And this is not some new or obscure science research. The pharmaceutical industry has spent a lot of money over the last decade and more trying to find a new generation of psychiatric drugs that would interfere with the hyperactivity of the HPA axis, because the evidence of its involvement in mental illness is so strong. In response, in my practice, I developed a deep relaxation brain training exercise to teach us to recalibrate and calm down our excessive stress responses, with the intention of removing that one from the chart so that in the future, when I or you hopefully go through a stressful event, it no longer can get inside our HPA axis, inflame us, discombobulate our neurotransmitters and neuroplasticity and take us down for another round of mental illness. The important takeaway here is, if you want to combat your bipolar disorder, you should recalibrate your HPA axis. Failing to do so is going to leave a significant inflammation and immune provocation inside your brain. If you'd like to get a free copy of my instructions on how to do that, including an MP3 recording to guide you through the process, just email me and I'll send that to you for free. Moving on, number 6, the gut microbiome. It's now known that the gut microbiome, or the colony of bacteria that live in the intestines, exerts some effects on the way the brain functions. A healthy gut microbiome actually grows neurotransmitters. Now, the neurotransmitters in the gut don't travel into the brain, but rather they send signals up the vagus nerve to the brain. And these signals have balancing effects on our neurotransmitters. They calm down inflammation levels, improve our resilience to stress and sleep. Furthermore, a healthy gut microbiome grows a chemical called butyrate. And butyrate grows and strengthens, you could say thickens, the gut walls, making them less leaky or permeable to the bacteria they contain. If you have thin and permeable or leaky gut walls, then the bacteria in the intestines can leak out into the bloodstream. When the immune cells in our blood come into contact with bacteria, it provokes them to discharge inflammatory cytokines. And for some people, this can be a major source of chronic inflammation. Now, I just want to circle back to GSK3 for a moment. The size of the cytokine discharge from the immune cells in the blood is actually set by GSK3 levels. When GSK3 is high, we discharge much more cytokines for the same level of bacterial provocation. So a leaky or permeable gut is even worse, I mean more inflammatory, for us with bipolar disorder and depression, because we have high GSK3. The solution to this problem is grow more butyrate inside your intestines to thicken and strengthen the gut walls, reducing the amount of bacterial leakage. And then on the outside of the intestines, in your blood if you want, we should lower our high GSK3 so that any bacteria that still manages to leak through into the blood doesn't produce such a big discharge of cytokines. Butyrate is a short chain fat molecule made in the intestines, and it's kind of wonderful stuff. Besides growing stronger, less leaky gut walls, in animal studies, butyrate has been shown to have anti-manic effects. The size of the anti-manic effect from butyrate is probably quite small, but when you're combating a mental illness, take all the help you can get. If you're living with bipolar disorder or any other mental health condition, you absolutely want to take advantage of the gut microbiome butyrate system to reduce inflammation in your brain. You can actually buy butyrate as a supplement, but the right way to get the health benefits of butyrate is to grow it inside your intestines so that it's delivered directly to the gut wall cells that need it the most. And the only way to grow a lot of butyrate in the intestines is to feed your gut bacteria a lot of fiber. You may have heard me say this before, but if your starting position is a leaky gut and a low fiber diet, you should start with supplementing butyrate, then very slowly over several months build up your fiber intake. Don't suddenly go from a low fiber diet to a high fiber diet. I know today everybody thinks they're a nutrition expert because they've got YouTube, but you really should work with a qualified nutritional or functional medicine practitioner that actually specializes in gut health. If you don't have the experience to know how to heal a leaky gut, you could easily temporarily increase inflammation and aggravate your condition. There are lots of great nutritionalists available, but if you want to work with me, I actually used to specialize just in treating gastrointestinal problems. And I bring that past experience of working with the gut over to the work I do today, which is specializing in brain and mental health problems. The popular carnivore diet and low FODMAP diet totally miss out on the treatment or therapeutic benefits of a healthy gut microbiome and the butyrate system. On a keto diet, you can get a lot of fiber from keto-friendly green smoothies, flax and chia seed and psyllium husk biscuits. You can see recipes on YouTube. There's actually some research that indicates that the gut microbiome may be altered in people with bipolar disorder, and that we may inherently have less bacteria and a less diverse colony of bacteria. But we can easily compensate against this and correct it with a very high fiber diet. And finally, what about probiotics? Generally, the results of science studies have been mixed, but there was one remarkable double-blind placebo-controlled study that showed a specific probiotic, Bifido animalis lactis, reduced the readmission to hospital for bipolar mania by an impressive 50% compared to the placebo. And the people taking the probiotic that did still relapse recovered 2/3 more quickly compared to the placebo group. Now, if this result turns out to be reproducible, it's a remarkable breakthrough. A simple probiotic could significantly reduce our problem. Could I ask you for a favour on this? In the UK, I can buy Bifidobacterium lactis bacteria from a company called Epigenetics, but I'd like to be able to source it and prescribe it for my American patients. According to Google's AI, it's also known simply as Bifidobacterium lactis, and this is available in the US, but my question is this exactly the same bacteria species used in the study? Any help you can offer would be really appreciated. While I'm asking you for favours, if you think that you're getting any benefit or value out of this video, could you please give me a thumbs up? And if you want more of this content and don't want to miss any future videos, why not subscribe, and don't forget to click the notifications bell. By interacting with the video in this way, it helps the YouTube algorithm to spread this information to more people who may benefit from it. I also really appreciate reading the comments and try to answer as many of them as I can. Okay, moving on to number 7, which is sleep cycles, and number 8, which is sleep amount. In bipolar disorder, sleep's interesting and important. Disturbances in sleep, both the amount we get and the timing of it, are actually physiological or biological features of bipolar disorder. Not only can a lack of sleep trigger mania, but also mania can speed the brain up, so much that it creates insomnia. And if you go too long without sleep, it can actually trigger psychosis. I used to think that when I treated my bipolar disorder, then my sleep cycles would go back to normal. It turned out to be the other way around. By targeting sleep and treating my sleep, I was actually treating the bipolar disorder. To live well with bipolar disorder, we should train ourselves to be above average at getting good sleep, and then always make sure that we get enough sleep every 24 hours without fail. Bipolar disorder, specifically mania, doesn't just give us issues with the amount of sleep that we can get, but another specific feature of bipolar disorder is there can be disturbance in the timing of our sleep-wake cycles. There's actually a structure in the brain called a suprachiasmatic nucleus, or biological clock, and it goes out of balance in bipolar disorder. If your biological clock is set to night owl mode, late to bed, late to rise, and you have to get up early for work, it's not just that you haven't had enough sleep, it also means you're actually up and awake and walking around in what is for your body the middle of the night. And this is a recipe for triggering mania. You should also note that a lack of sleep is another significant source of inflammation and compromised neuroplasticity. Most people go to bed, cross their fingers, and hope they have a good night's sleep. But for us with bipolar disorder, that's not good enough. I decided that to live well with bipolar disorder, I had to be able to pretty much guarantee I was going to have a great night's sleep. Well, the good news is it turns out that we can actually train our sleep physiology, or entrain it. Sleep physiology is affected by the timing of blue light entering the eyes. We want blue light in the morning, no blue light in the evening. We want to change our body temperature. Our body and brain temperature changes in the day, and there are supplements and techniques we can use to enhance that. We can change the timing that the HPA discharges and stops discharging cortisol. Nighttime cortisol inhibits sleep. Anybody with sleep issues can use those techniques, but with bipolar specifically, we also need to know how to counteract excess glutamate and second messenger signals so that we're able to switch the brain off to get to sleep. I spent a year in training my sleep physiology so that I am assured I can always get enough sleep. Think of it like this: there are 13 things that have been identified that can go out of balance in the bipolar brain. And to live well with bipolar disorder, we want to systematically remove as many of them as possible. Let's remove sleep as an issue. Let's remove stress as an issue. Remove inflammation, mitochondrial dysfunction, weak neuroplasticity, and the other things, so that we take control of our bipolar disorder rather than our bipolar disorder from time to time taking control of us. If you're really interested in training yourself to be a better sleeper, and you want to get the most up-to-date techniques and information that I use, you can book a one-to-one consultation with me. Going beyond just getting enough sleep, there's actually a treatment we can use, a sleeping treatment, which is a protection against mania and also a treatment for mania should it recur. It involves sleeping in a 100% totally blacked out bedroom, and then for a few hours before going to bed, blocking blue light from hitting the eyes by wearing blue blocking glasses. I think this technique is amazing. I think it's the most exciting new development in the treatment of bipolar disorder since the discovery of lithium. Okay, moving on to number 9, oxidative stress. Studies have consistently found increased levels of oxidative stress in the bipolar brain, and this causes all kinds of problems. Oxidative stress is where oxygen atoms, a type of free radical, that are very unstable, damage any surrounding molecules or structures that they touch. Our brain and the rest of our body makes antioxidants to try to neutralize free radicals. We can also get antioxidants from our diet. When the production and burden of free radicals exceeds our capacity to neutralize them with antioxidants, it causes damage to our brain cells, synapses, and other structures. Oxidative stress, or the damage it causes, is also another significant source of inflammation. Something we can easily do to combat oxidative stress is to eat a diet very high in antioxidants and polyphenols. I mean berries, purple cabbage, black beans, red peppers, that sort of thing. Another important thing to reduce oxidative stress is to improve the health of our mitochondria, because most oxygen-free radicals come from dysfunctional mitochondria, which is the next thing I'm going to talk about. Now there are many supplements with antioxidant effects, too many to mention, but there are 4 that stand out as being particularly helpful for the bipolar brain. The first one is NAC-cysteine. It raises glutathione levels in the brain. Glutathione is the brain's primary antioxidant. It helps the liver to detoxify. Low doses of NAC attenuate glutamate, and you can use higher doses of NAC to boost dopamine. The second antioxidant supplement I recommend is zinc. It's not particularly famous for having antioxidant properties, but it does have them. And it also attenuates glutamate and improves sleep. It's also very often deficient in our diets. A third powerful antioxidant supplement that I would recommend for bipolar disorder is curcumin. That's the chemical extract from the spice turmeric. I recommend curcumin as an antioxidant because it's also a very powerful anti-inflammatory and a strong booster of BDNF and neuroplasticity. It has antidepressant effects, but does not flip people up into mania, which many other antidepressant substances can do. And the fourth antioxidant supplement that I particularly recommend for bipolar disorder is alpha-lipoic acid. Like NAC, it's a great general and quite powerful all-round antioxidant. It's also protective against diabetes and stabilizing blood sugar. It's anti-inflammatory, and it also has protective effects against mitochondrial dysfunction, as does NAC. So NAC and alpha-lipoic acid are both antioxidants, anti-inflammatory, detoxifiers and so forth, but they also protect against mitochondrial dysfunction, which is number 10 on my chart of the 13 causes of bipolar disorder. Mitochondria are tiny structures within our cells. Each cell contains from a few hundred to a few thousand mitochondria, and studies have consistently found mitochondrial dysfunction in bipolar brains, and this is significant in several ways. Firstly, dysfunctional mitochondria are responsible for making most of the damaging oxygen-free radicals I've just mentioned. Secondly, mitochondrial dysfunction contributes to the loss of regulation of the second messenger signaling system within the brain cells. This is because mitochondria are involved in stabilizing calcium levels, calcium ions within our cells. And the release and flow of calcium ions within the cells is a central part of second messenger signaling. If you remember when I discussed the list of supplements we can use to stabilize second messengers, it included curcumin, or at least I hope I put curcumin in there. And it's believed that the mechanism whereby curcumin stabilizes against excessive second messenger signaling is because it stabilizes and moderates the release of calcium ions from the mitochondria. And lastly, one of mitochondria's major roles is the production of cellular energy. And there's a theory that mitochondrial dysfunction is also directly involved in the unstable energy we see in bipolar disorder, the increased energy of mania and the decreased energy in depression. And as with all of the things I'm mentioning, there's a lot that we can do to improve the health of our mitochondria. Both the plant-based diet, which is the highest diet in polyphenols, and the ketogenic diet improve mitochondrial dysfunction. There are the supplements I've just mentioned, NAC-cysteine, alpha-lipoic acid. Another thing that combats mitochondrial dysfunction is melatonin. Now, there's another supplement that's famous for improving mitochondrial dysfunction, but I'm saying don't take it. It's acetyl-L-carnitine. There's two reasons why you shouldn't take acetyl-L-carnitine. One is it's a really powerful energizer and antidepressant. If I take acetyl-L-carnitine, which I have in the past, it just flips me straight up into mania. But the other reason not to take acetyl-L-carnitine is because studies have shown a variant of it, L-carnitine, increases the production of a chemical called TMAO, which increases the risk for developing cardiovascular disease. And until we know for sure that this TMAO production only pertains to L-carnitine and does not apply to acetyl-L-carnitine, I'm saying we should stay away from it. Because I'm going to mention later that we people with bipolar disorder have a significantly increased risk of developing cardiovascular disease. So you don't want to take a supplement that could contribute to that. But I've saved till last what is probably the best technique for getting rid of dysfunctional mitochondria, and that is intermittent fasting. When we go into fasting mode, our body goes into what's called autophagy. It releases these autophagy enzymes. The autophagy enzymes go around gobbling things up to recycle fats and proteins and sources of energy to keep us alive. And in the process of doing that, they break down and gobble up old and dysfunctional mitochondria that are leaking oxygen-free radicals. And then our cells make brand new, healthy, functional mitochondria to replace them. In my practice, I use a sort of enhanced fasting technique, which is to do a semi-fast and at the same time, on the same day, you take a stack of supplements that boost the production of autophagy enzymes. If you'd like to get the instructions and details on how to do that, I'll send it to you for free as a PDF. If you stick around to the end of the video, I'll tell you how to get that. Okay, moving on to number 11, neuroplasticity. Another consistent finding within the bipolar brain is that we have poor neuroplasticity. Now, in this context, we're referring to neuroplasticity as the ability of the brain to protect itself from damage and then repair itself after it has been damaged. A primary chemical involved in this type of neuroplasticity is called BDNF, or brain-derived neurotrophic factor. You can think of it as the brain's growth chemical or growth hormone. And the problem we have in bipolar brains is we have low levels of BDNF. We just don't make enough. And this is especially bad because, as I've just mentioned, our brains have increased levels of wear and tear coming from inflammation, mitochondrial dysfunction, and oxidative stress. So to keep our bipolar brains healthy, we want to not only reduce all the wear and tear on our brain, but also deliberately boost BDNF and neuroplasticity. This doesn't have to be a problem because we now know lots of ways of boosting neuroplasticity. A healthy diet, intermittent fasting really boosts neuroplasticity, exercises, specific supplements, including lithium orotate, curcumin, fish oils, bacopa, skullcap, zinc to some extent, quite a few of the Chinese herbs like magnolia bark, castrodia, polygala, and several others. Something that's really important to know, I mean life-saving important to know, is that low levels of BDNF and high levels of inflammatory cytokines have been observed in the brains of people with the most severe depression, treatment-resistant depression, suicidal ideation, and worse. When somebody comes into my clinic in that situation, the absolute top clinical priority is to rapidly reduce inflammation and increase BDNF. I've seen many patients surprised at how using this strategy can quickly throw a switch that turns off the suicidal ideation. They may still have depression, but the suicidal ideation disappears. Moving on to number 12, accelerated brain aging. Now, accelerated brain aging is one of the two consequences of living with bipolar disorder, as opposed to one of the 13 causes of bipolar disorder. What happens is, because of all of the extra wear and tear we have in a bipolar brain, from inflammation, oxidative stress, etc., on the one hand, and the poor neuroplasticity or ability to protect and repair the brain we suffer from on the other hand, we end up with accelerated brain aging. Another thing to understand is that manic episodes put a tremendous amount of toxic wear and tear on the brain. High levels of glutamate are toxic, and there's the excessive breakdown products of elevated dopamine, which are also toxic. In terms of toxicity, it's kind of equivalent to taking cocaine or crack cocaine, something like that. And the more rounds of mania a person has, the more accumulated damage. Therefore, the earlier you can start your treatment and prevention, the better. Unfortunately, all too often, people living with long-term bipolar disorder and schizophrenia suffer impaired brain function and cognitive decline in later years. This can lead to a loss of independence, and it's associated with a 3 to 4 times increased risk of developing dementia. In bipolar disorder, this state of affairs is called neurological progression. Brain scans have shown that in elderly bipolar brains not treated with lithium, there's an increased level of brain shrinkage. However, the good news is that scans have also shown people with bipolar disorder treated with lithium have brains that look indistinguishable from people that do not have bipolar disorder of the same age. There are many supplements and techniques that boost neuroplasticity, but we have to choose ones or use ones that are appropriate for use in the bipolar brain. We shouldn't use neuroplasticity boosting supplements that are likely to flip us up into mania. To meet our needs of stabilizing our bipolar disorder on the one hand, but also boosting BDNF and neuroplasticity on the other, the most appropriate supplements are lithium orotate, curcumin, magnolia bark, bacopa, skullcap, and omega-3 fish oils. I hope you're finding some useful information in this video that you can put into action by yourself. But if you'd like my professional help in putting together an individual treatment program of supplements, diet and brain training exercises, I do one-to-one consultations online. Specifically for bipolar disorder, I've developed a 3-prescription treatment system. There's one prescription which is for maintenance and prevention. There's another separate prescription to take if mania has returned, even if it's just attempting to return. And a third prescription to utilize during phases of depression. And it's important in that prescription to also include things that prevent the antidepressant from flipping you up into mania, burning your brain out, and then you end up back in the depression. During the consultation, we can discuss the individual ways that you can recognize the signs that tell you when you need to change from one prescription to another. The goal is to put you in the driving seat and in control of your bipolar condition. Another goal of the treatment, you could say like a foundational goal of the treatment, is to contain strategies that counteract the 13 known causes and 2 consequences of bipolar disorder. As I said before, to remove as many things as possible from the chart, ideally remove them all. As far as I know, no one else has developed this 3-prescription system. Now that's not me being egotistical, it's just I happen to have the rare combination of being a functional medicine practitioner for 35 years, having bipolar disorder myself, and specialising in treating mental health problems. In years gone by, bipolar disorder would wreck my life. I didn't used to be so rapid cycling. I had long hypomanias and really long depressions. So in a hypomania, I would build some work and career success, relationships, and then go into depression, and I couldn't sustain any of it. And then some years later, I had nothing, and I would have to restart my life over again. That was my life for about 25 years. However, today, using these techniques, I've managed to put my condition into remission and keep it there for over 15 years. If you go online and ask the question, what causes bipolar disorder, the answer you get back is, the exact causes of bipolar disorder are unknown. But that's not right. We do know the exact causes of bipolar disorder, or at least we know a lot. Last year, just to make sure I could back up that statement, I read 130 science papers, this is double-sided A4, and several books on the neurobiology of bipolar disorder. And in all the papers and all the books discussing the neurobiology of bipolar disorder, the same 13 causes and 2 consequences are mentioned. If you're interested in doing some of that reading for yourself, I would say that this book here, The Neurobiology of Bipolar Disorder, Road to Novel Therapeutics, is the most up-to-date book. And this is a great starting paper, The Underlying Neurobiology of Bipolar Disorder. Remarkably, this paper was published in 2003, and already back then, many of the things I'm mentioning were known, or many of the things I'm discussing can be used as adjunctive therapies, alongside the pharmaceuticals that you take. I would love to see some of you in my practice and work with you to help you achieve your health goals. If you wanted to book an appointment, just type calendly.com/PeterSmithUK into your web browser, pick a time, go through the payment process, and I'll see you there. Okay, let's finish off the chart. Number 13, changes in brain structures. Brain scans have shown that in the brains of people with bipolar disorder, scans have shown that in bipolar brains, there are changes in the size and function of some of the key structures involved in controlling mood, how we feel, structures involved in controlling impulsivity, and so forth. So, for example, we have a diminished number of connections running from the frontal thinking part of the brain down to the emotional regulation centers. And as a result, we can have poor regulation of our emotions. Another finding is that there is hyperactivity in a structure called the amygdala. This can result in exaggerated emotional responses. Well, there's actually quite a lot we can do to compensate for structural changes. It's been shown that within just a few months of meditation, you can actually see in scans changes in the wiring and structures of the brain. We can, for example, stimulate the growth of more connections from the frontal lobes down to the emotional regulation centers, giving us better what's called top-down control. It's also been shown that in as little as 3 months you can dial down the reactivity of the amygdala. And something that's really cool is the effects of meditation exercises are really long lasting. I mean, they last for years. I made a video called Solving Anxiety, in which I discuss using brain training exercises to change the wiring and structures within the brain. Although the title says anxiety, a lot of the information in that video also pertains, or equally pertains, to the bipolar brain. Oh, let me just quickly say something here. The meditation brain training exercises I use in my practice are totally non-religious, so you can use them whatever your faith belief. Think of it like you would do physiotherapy training exercises to strengthen specific weak muscles in your body. The meditation brain training exercises are simply to strengthen weak systems in the bipolar brain. Moving on, number 14, EPA deficiency. As you probably know, EPA is an essential omega-3 oil found primarily in fish. Now, it's not a well-researched finding, but there's a little evidence that we with bipolar disorder have a deficiency of an enzyme that carries EPA across the blood-brain barrier from the blood into the brain. And as a consequence, bipolar brains end up with EPA deficiency. And this can have profound negative consequences. A deficiency in EPA is going to result in increased inflammation, decreased neuroplasticity, and excessive second messenger firing. This is just a personal anecdote, so I can't prove it scientifically. But when I first started developing treatments to combat my own bipolar mania, one of the things I discovered was that if I took a really large excessive dose of omega-3, it would kick me out of mania. In fact, sometimes produce several days of a mild depression. Now, it's possible, hypothetically, that works because a high dose of EPA might have a heavy, strong suppressing effect on second messengers and will put a stop on the excessive firing inside the neurons. Finally, the last one, number 15 of 15, cardiovascular disease. We people with bipolar disorder have a 2/3 increased risk of developing cardiovascular disease. That's heart attacks and strokes. Now you might think, well, what has cardiovascular disease got to do with bipolar disorder? Well, it actually makes sense because many of the things we have in bipolar disorder also increase the risk for cardiovascular disease. So, systemic inflammation increases the risk for cardiovascular disease. Poor sleep, believe it or not, increases the risk for cardiovascular disease. Overactivity in stress responses, so internal stress, increases the risk for cardiovascular disease. Oxidative stress, mitochondrial dysfunction, and so forth. So what's kind of nice about that, in a funny way to put it, is that you don't really specifically have to do anything about the cardiovascular disease. You just treat all the components of the bipolar disorder. In doing that, the risk for cardiovascular disease and dementia should also go down. So just eat really well, lots of polyphenols and fish oils, sleep well, get a bit of exercise, reduce your stress responses, and do the other things, and you can treat the causes of bipolar disorder and the consequences of bipolar disorder together at the same time. So there you have it, the 15 causes and 2 consequences of bipolar disorder. When not properly treated, bipolar disorder can wreck your life, but I believe it's a very treatable condition, and I wish you every success in achieving your health goals. Bye for now. Don't forget to like, subscribe and comment. If you'd like to get the Deep Relaxation Brain Training MP3 or the instructions on the supplement enhanced intermittent fasting technique, then just email me and ask for them. My email address is hello@petersmithuk.com. hello@petersmithuk.com.